So cataract surgery can be performed as a standard cataract surgery or a refractive cataract surgery. Refractive cataract surgery means apart from removing the cataract, we try to remove the full number as much as possible. The first difference is the incisions. In the standard cataract surgery, the incisions are taken by a blade as seen on the right side of the screen, and on the left side of the screen, the incisions are taken by the laser. There are two advantages of this incision taken by the laser. One, it's a step incision, so it seals better, and number two, the incisions are planned in such a way that it reduces the cylindrical number. The second difference is the capsular axis. The capsular axis is the most important part of the surgery. If we get the capsular axis right, 80% of the complications are saved. Now what happens is that in a manual technique, on the right side the capsular axis is made by a forceps or a needle manually with the surgeon's hand, and on the left side you see that the capsular axis is made a perfect circle, the size as desired by the surgeon, 4.95, 5.1, and it is made by the femto laser, so it is very accurate. This accurate capsular axis helps better positioning of the lens perfectly in the center, and this allows the rays of light to fall perfectly in the center of the retina. The third big difference is this is how the cataract is manually broken with the help of a chopper and a phaco probe in the conventional method into 4 or 6 smaller pieces. This is a very difficult step, especially in hard cataracts. Now when we do it with the femto laser, the breaking of the cataract into its 6 pieces is done by the femto laser. So if it's a hard cataract or difficult to crack, it is easily done with the femto laser. This causes lesser inflammation in the eye post-op. You can see 6 pieces like a pizza being cut, the incision being made and the capsular axis all happening in less than 2 minutes. So it is much safer, causes lesser inflammation, reduces the heat in the eye, and it's a cooler process, reduces the power required for removing the cataract, also reduces the cylindrical number or the astigmatism. An astigmatic cornea, if you see, is nothing but the corneal shape is like a rugby ball, while here it is like a baseball. And if you do not correct the astigmatism, the vision can be hazy. With the femto laser, we can correct the smaller astigmatisms up to 1.5 diopter, and if the astigmatism is more, then we need to implant a lens which is known as a toric lens, which corrects the astigmatism. Here in the femto laser, the capsular axis gives us 2 nice nubs or markings such that the alignment of the dots which are on the lens align perfectly with the axis that was planned for the patient. So the toric alignment in the manual technique is done by ink marks, and in this technique it is done much more sophisticatedly such that the placement is exactly to the T, and this helps in lesser specs number post-operatively. So in short, a femto laser increases the safety of the procedure. Safety is the biggest benefit. Second, the precision is much more, the reproducibility of the procedure is much more, and most importantly for the patient, there is faster healing, lesser swelling, crisper vision, more safety.